Hello and welcome to HBW-TV. We're back again at the beautiful Penang Golf Club, but this time we're with Dr. Jack, a practicing doctor of 17 years with 3 years specializing in plastic surgery.
Thank you for having me.
So tell us, the big question. Hollywood has this, we've all known about it, but there's a lot of unanswered questions. What is plastic surgery?
Okay, so I think that's a very important question. Okay, so what is plastic surgery? So plastic surgery has got a very unique name, plastic, but it's got nothing to do with the material plastic. So it actually comes from the Greek word that means mold.
Okay.
So that's where the actual meaning of plastic comes in, to mold. So that's where the molding surgery, or the surgeons that mold things on the face, on the body, so that's where plastic surgery comes in. So to dispel the misconception that it's got nothing to do with the bottle plastic or the material plastic or plastic bags, no.
So the joke that people give that you can be recycled, that's just all out the window. Yeah.
Out the window, definitely out the window, yeah. Plastic means to mold, from the Greek word mold.
Okay.
That's it, yeah. And that's the basic meaning of plastic surgery.
So we hear a lot about how plastic surgery has gone back decades, centuries even. Could you tell us a little bit about the history?
The first understanding of plastic surgery is that it doesn't have a particular organ. Like, let's say a dermatologist, they're skin specialists. Gastroenterologists, they are bowel specialists. Orthopedic surgeon, bone specialists, bone surgeons. So plastic surgeons, we operate from head to toe. And the reason why that happened is because when it's also a specialty that is very war-driven. Okay, I'll explain that. So the explanation for that is when World War I, World War II was going on, there was a certain set of injuries that were not defined into any particular surgical category. So head and neck surgery, you know, it was different, you know, dental surgery and things like that. So that's where the birth of plastic surgery came about. There was this very unique set of injuries and problems that were faced by a lot of surgeons at that time. And that's where the surgeons had to come up with an idea of tackling these issues. And that's where the birth of plastic surgery came about. So in fact, if you want to go even further, it started off, a lot of people say that, you know, the birthplace of plastic surgery is actually in India, with nose reconstruction. So that also has got a very long history of, you know, how from India plastic surgery was actually came into the Western society. So it's a very detailed, very long history. But the bottom line is it goes back far, but it's just recognized as plastic surgery as a category, as a field of its own in the war period. Yeah. So that's how the whole thing came about, and that's where we are now.
All right. So now in the 21st century, we have Hollywood, we have, you know, the UK version, we have Bollywood. Plastic surgery is a term that gets thrown around a lot. So what would you say plastic surgery has an effect, or where does it stand in today's society? What is it now?
For plastic surgery and plastic surgeons all together, there's a type of plastic surgery that suits every surgeon's personality, a plastic surgeon's personality. So those who are interested in cosmetic surgeries, you can see they're more out there in the media. They are more sociable type of individuals. There are those who only do reconstructive surgery. They come in a different category of people. They work long hours in the operating theatre, doing reconstructive work and things like that. So it depends on your particular interest in plastic surgery. And I guess it comes down to the point of how big actually is the scope of plastic surgery. It's big. It's really, really, really big. And it takes 5 years or more to actually train. There is a thing as a general plastic surgeon, and there is a thing as a subspecialized plastic surgeon as well. So plastic surgery on the whole is reconstructive surgery, cosmetic surgery. Okay, so reconstructive surgery comes in the category of trying to restore function that has been lost.
Could you give an example, please?
Okay. Like if you look at burns, for example, someone who has a burn injury. So now that person is now no longer, say, okay, burn injury to the hand. So the hand is no longer normal anymore. So now the plastic surgeon's job is to try and get that abnormal situation and return it back to normal. So that's reconstructive surgery. Someone who has got a very big tumor in the muscle or the leg. So that whole muscle and that big area needs to be removed. So now so that area is not normal anymore. We need to reconstruct it to be normal again. Another example is breast. So breast cancer, someone loses their breast to the surgery to the breast cancer. So we need to reconstruct the breast again.
Okay.
So now if you take that same idea, the breast, and now let's talk about cosmetic surgery. So cosmetic surgery is taking something that is normal and making it better than normal.
Okay.
Up to the person's perception or up to the society's perception of what is something that looks better than normal. So same thing goes to the breast as well. So now you have someone who's got normal breasts.
But they want it bigger.
Exactly.
Or smaller.
So that is cosmetic surgery.
Okay.
So within reconstructive surgery itself, there's so many different categories. Cleft lip is a reconstructive surgery. So pediatric plastic surgery, that means plastic surgery that involves only children. That's another big category of plastic surgery. Then there's also craniofacial, which is something I was involved in my earlier days as a plastic surgeon, where we alter the shape of the skull for certain children who are born abnormal. So that also comes under pediatric plastic surgery. Facial traumas, facial bone fractures, those are all. Then you got microsurgery, which is another category. So it's big. It's really, really, really big. And like we were talking about earlier, like the textbook. The plastic surgery textbook held the record for the biggest textbook in medical history for the longest period of time.
Oh my goodness.
And 8 volumes of textbook, and only one of it is cosmetic surgery. But that one particular field of plastic surgery gets the biggest media attention compared to all. So it's actually very big, and cosmetic surgery is just one part of it. So that's the whole scope of plastic surgeons, yeah.
Could you give us a rough overview of the other categories of plastic surgery other than cosmetic?
So cosmetic surgery is one of them. Then you have surgeons who specialize in lower limb reconstruction alone. That's one big area. There are surgeons who just do burns. So they specialize in burns surgery. Okay. And then there are those who, like I mentioned earlier on, pediatrics. Okay, those who specialize in cleft lip surgery. Okay. Then there are those who specialize in microsurgery. Microsurgery is actually a very big field of plastic surgery. Microsurgery is basically where we take body from we take a part of your body from one area, and we use that particular unit to reconstruct something else in the body, like breast, for example.
Okay.
So if breast, for example, that means we take your fat and your skin from the abdomen, along with the blood vessel that supplies that whole unit. And we find a suitable blood vessel in the area of the breast, and we use that to reconstruct the breast by stitching up the blood vessels. So the blood vessels can be something, the average diameter of about 3 millimeters. So we use a microscope, and we use the microscope to repair. So that's microsurgery. So hand surgery is another big part of plastic surgery as well. Hand surgery. So these are all the bigger area, the bigger lump sum categories of plastic surgeries. So there are a lot of plastic surgeons who specialize in one particular field, and they do it day in, day out. And so in my area, last few years I've been specializing in cosmetic surgery. So that's where. But there are others who do cleft lip all the while. There are those who just do microsurgery most of the time. So that's the difference, the big category of plastic surgeons.
That's wonderful. Getting back to the transfer that you were talking about, I was just curious, how does fat from your stomach grow on your chest?
So basically, whatever you have in your abdomen, the skin and the fat that's below, the skin and then the fat that's below the skin, so whatever that whole unit is taken up, and it's transplanted to the breast area, it's completely detached from your body. It's completely detached. And the blood supply that is providing that area is completely detached as well. So literally it's lying on a separate table. And then we take it and then we stitch it back and resupply and re-establish the blood supply by stitching it to another blood supply, a source of blood supply in the chest area. So this is one example of microsurgery. So that happens everywhere, even in head and neck surgery, the lower limb for the legs as well. We take the muscle from the back and then we put it to the leg. So it's a big realm of microsurgery. So microsurgery basically means that the stitching up of blood vessels, the tiny blood vessels. So it's very small, about 3 millimeters, sometimes it's bigger, sometimes even smaller. Another up and coming field of plastic surgery also is super microsurgery, which is even smaller. That means you're stitching up blood vessels which is 1 millimeter in size. So it's up and coming. So it's very fascinating. I think it's in the frontier of medical development. It's a very young field per se. So a lot of interesting developments. What
is the potential of the super microsurgery that you were talking about?
It depends on the surgeon who wants to take it up. I guess in Malaysia, not so much, but it's very famous in Japan. And I guess it's also if you have the volume enough to have that workload for your day-to-day, cases, then you can get good at it. But if not, if you're not working in a particular hospital that has got the volume of cases that need that kind of surgery, you're never going to be good at it. So it's not easy to go into. So yeah, but it's up and coming. I know some of my colleagues have tried it, but it's not easy.
So last question before we leave. Our next episode will be talking more specifically on cosmetic surgery. Would you like to give us a short teaser on what we'll be talking about?
Cosmetic surgery.
Yeah.
So I guess in the next segment there'll be a lot of things that you would want to hear, and there'll be a lot of things that you'll be shocked that you don't want to hear.
Okay.
So yeah.
That'll be wonderful. Thank you so much, Doctor. We look forward to seeing you on the next episode.